In your morning medical news, a new study finds more people with type 1 diabetes are using GLP-1 medications like Ozempic. These drugs were developed for type 2 diabetics, and clinical trials specifically excluded type 1 patients. Despite limited evidence on their safety and effectiveness, many doctors are prescribing these medications off-label, especially for patients with obesity. New research showing your drinking habits today could impact your memory tomorrow. A study of 1,700 older adults found heavy drinkers face more than double the risk of developing brain lesions. Scientists defined heavy drinking as 8 or more alcoholic drinks per week. Even former heavy drinkers showed an 89% higher risk compared to non-drinkers. Moderate drinkers weren't in the clear either. They still had a 60% elevated risk of brain damage. Dementia and depression often go hand in hand. Patients with Alzheimer's disease, but many don't respond well to traditional antidepressants. Dr. Malika Marshall shows us an experimental home-based electrical therapy that may be able to treat memory loss and mood.
Julie Whelan loved being a medical librarian at Harvard, but the 76-year-old had to retire when her mind started to slip.
It wasn't just, oops, a mistake. It was something more.
That something more was Alzheimer's disease. And like many patients, Julie started to feel depressed.
Wonderful husband here that helps me, but he's got his own things he has to do, and I feel lonely. And I can't see my grandchildren because I can't drive.
Researchers at Harvard-affiliated Hebrew Senior Life say antidepressants don't work well in older adults. So they're studying the effects of transcranial electrical stimulation on both depression and memory loss in patients with Alzheimer's, delivered right at their home.
It is not the same as shock therapy, ECT. It is delivering electricity to the brain, but in a way more controlled manner that is targeting only specific regions of the brain.
A caregiver attaches multiple electrodes to a soft bonnet, which is secured to the patient's head. Gel is applied to the scalp and leads are attached to each electrode. An iPad walks them through the steps systematically.
Each session takes about 22 minutes, and Julie needs to stay silent and still during that time.
Julie did 5 treatments a week for a month.
Is it painful?
No.
She's not sure if the treatments helped, but
she's back reading now, more books than I am now.
And we are seeing preliminary signs of improvement in depression, also some preliminary evidence of memory symptoms improvement.
Julie's hope for the future?
Just to be able to find a way to deal with this that lets me still be happy with my family.
And who doesn't want that?
Researchers are still recruiting patients 65 and older with the diagnosis of major depression and mild stage Alzheimer's disease.